Hello, my name is Kelly Manda, and I am a doctoral student at Franklin University. I will be presenting a gap and SWOT analysis of a private spine practice today. According to Golden et al., health systems are working to develop efficient, integrated approaches to delivering care that enhances value for the patients they care for and the populations they serve. This integrated approach is what the private spine surgery practice discussed in this presentation needs to address the discovered gap in clinical care for the post-surgical patients. The clinical gap identified was brought to light during an interview with the primary surgeon in the practice and a key stakeholder, the Director of Surgical Services at the macro system where the surgeries for this practice are performed. The gap in care is effective pain management for post-spine surgery patients. A literature review for evidence-based policies and protocols was performed to determine if a gap in care was present, and the Agency for Healthcare Research and Quality Pediatric QI Toolkit was utilized. The practice does not have any specific written policy or protocol in place regarding postoperative prescribing, but have a blanket prescription protocol that is utilized for all patients unless patient specifically states that they are on different medications prior to surgery. Once the gap was identified, a clinical care change plan was proposed with the intention of implementation. This change plan will improve knowledge for both providers and patients by improving the process of care within the practice with goal of improved patient outcomes post-spine surgery. Once a gap in clinical care was determined with the proposed change, a SWOT analysis was completed. A SWOT analysis is a strategic planning method used for evaluating the strengths and weaknesses and opportunities and threats of a healthcare institution from both internal and external sources, with positive and negative aspects of each being analyzed. The internal factors that may affect success of the proposed project change include both strengths and weaknesses. The positive factors include having a motivated staff comprising of the office manager and the medical assistants. The entire staff want to find a way to improve the postoperative outcomes for the patients. The plan is cost effective as there are no unexpected costs that will arise during the planning, implementation, and evaluation phases of the project. As this is a private practice, not within a larger institution, there is not a need for an institutional review board, and both providers in the practice are supportive of the change project and anticipate the change causing a positive improvement for patient outcomes and patient satisfaction. There are a few potential internal weaknesses that can impact the project's success, the first being patient compliance. The screening will rely on accurate patient answers of the screening tool. Time restraints due to full schedules and overbooking can be a weakness as well. There is limited literature available to resource on the topic and only 2 providers in the practice to implement the change. The various types of surgeries that occur in the practice can affect the validity of the screening tool as well. As Needham et al. Explained, quality control methods are critical to help ensure the accuracy of any effort to collect, analyze, and report data. Just as internal factors can affect project successes, external factors can come into play as both opportunities and/or threats. The gap in clinical care identified shows that patient outcomes have room for improvement. This project can improve postoperative pain control and improve the patient outcomes and lead to improved patient satisfaction scores. There is the potential opportunity for publication if data supports evidence-based improvement, which in turn can lead to better marketing opportunities. Along with external factors bringing possible opportunities, there are threats that need to be considered. Biggest threat for success of the project is patient adherence. Improvement in healthcare is 20% technical and 80% human, and essential to that 80% is clear communication, clarity of approach, and a common language. Patients staying on or veering off a predicted course of postoperative treatment will skew the data during the data collection and analysis phase of the project. Just as patient adherence is vital, so is staff compliance. The staff must adhere to the plan and keep accurate records during data collection for accurate statistical analysis on the effectiveness of the project. Miscommunication between staff, providers, and patients can derail the project if not clear and precise. Finally, competition from other spine practices that already have a strong postoperative pain management process in place can lure patients away from this practice setting. An evidence-based screening tool will be introduced into the practice to better predict the pain management needs of the postoperative spine surgery patient within this practice. The goal for the QI project is to eliminate the guesswork for prescribing medications and get the best possible post-surgical outcomes for the patients by making prescriptions individualized to improve the process of care within the practice. These are the references used in today's presentation. Thank you for your time and attention.